skincare clinic today in Droitwich, witnessing some Botox treatments on one of our patients. I'm just in the process of marking my patient up before we do the treatment. I'm just going to finish doing this eye here, so if you can just turn your head away from me and give me a really big smile. That's lovely. And what we're trying to do is to reduce the muscle activity and relax, Jackie. Just going to go there to try and catch these little lines that bother her, that come under here. We're trying to reduce the muscle activity. Botox is a drug that temporarily puts muscles to sleep for about 3 or 4 months, and whilst it's working, certain facial activities are difficult to do, and that reduces the frowns and crow's feet here. We are actually using Botox. There are several versions of the toxin available, but the drug that we are actually using today is Botox. So I'm just going to start making some small injection points on this area here, and this is to try and stop the frown action for Jackie. So if you just relax, Jackie, and we'll just do a little small injection point here for you. Another one here. Jackie pulls her frown in a way that rooks up her nose as well, so I'm just trying to make sure that reduces for her, as well as this pull that she's getting in the middle here. And another little scratch here, Jackie. And typically this treatment will last around about 3 to 4 months before it needs retreating. And lots of people do ask me, well, what happens if I don't have Botox again? And the answer is that it's a temporary treatment and it just goes away. And really your skin returns to the way it was before. Having said that, it does have a preventative action, because whilst you can't frown, the skin over the top of the muscle can relax and have a chance to recover, and some of those wrinkles can be smoothed out. So basically you can buy yourself some time, in effect, if you by having toxins like Botox for a year or so. It can basically reduce the aging process. If you just turn your head slightly away from me there, Jackie, and I'm just coming a little bit lower on this crow's foot here. Botox is a drug that's now licensed in the UK for treatment on the glabella, which is the area I've just treated, and also crow's feet. It's just recently had an approval for treatment in that area. And I'm just being very careful here. There are quite a lot of vascular structures here, and Jackie has got a large vein which is pretty much in the area that I want to inject, so I'm just being mindful of that, because she wouldn't thank me for a black eye after the treatment. And this is it's a treatment that people can have done, and a few minutes after nobody really realises that you've had anything done. So it's a treatment that has minimal bruising and swelling afterwards. And just turn it slightly over. And just come in here. Gradually the muscle activity returns to normal. So after a period of about 10 to 12 weeks, your patient will notice that the movement starts to come back again. It doesn't come back overnight though, so they will then have a repeat treatment. There we go. And this drug takes about 7 to 10 days to work, so Jackie will notice within the next week that her ability to complete a frowning motion, and her ability when she smiles, the lines that just sort of form around here, the lines will be reduced. With Botox we try and keep the treatment quite natural, and keeping some facial expression is nice, because it's less of a telltale really that you've had anything done. Okay, there we go. Thank you. Thank you.